My name is Molly Stowe, and this diary is summarizing my internship completed during the spring semester of 2014. I am currently finishing my internship at Cape Fear Valley Inpatient Rehabilitation Center on the Spinal Cord Injury Unit in Fayetteville, North Carolina. During my internship, I have been able to work with many different diagnoses that I previously did not have experience with. This includes complete spinal cord injuries, muscular dystrophy, lupus, above and below knee amputations, multi-trauma, and traumatic brain injuries. At week 3, I began to take on my own caseload, and I worked up to an 8-patient caseload by week 5. Working with my own caseload included completing initial assessments, creating treatment plans, deciding which type of intervention would be used, and determining if they reached their goals by their scheduled discharge date. I have become more familiar with a larger variety of interventions that can be implemented and the purpose of each one. I have become more competent with my implementation skills, whether it is for one-on-one patients or for a group setting. Overall, upon completing this internship, I feel like I have accomplished everything I needed to work on and more. I have become more comfortable when approaching patients and determining their appropriate FIM score, and also working with interventions that are appropriate for them as an individual and for their diagnosis. During this internship, I was able to focus on my clinical writing abilities for patients while completing projects for the internship course. By week 3, I was able to accurately assess a patient using the Functional Independent Measure Scale in order to identify and compose the appropriate treatment plan that will address the assigned goals and objectives. Throughout the course of my internship, I had the opportunity to observe and shadow different therapy disciplines and treatment settings. I was able to expand my comprehension of how recreational therapy can coincide with each therapy discipline that is utilized, and how it can be functional in settings such as aquatic therapy and community reintegration. While completing courses, career exploration hours, and my senior practicum, I had not come across the opportunity to work with a patient that would be considered a challenge. However, during my internship, I was able to work with about 5 patients who proved to be a challenge and a major learning experience for me. An example of the challenging patients I worked with on my caseload had a diagnosis of a complete spinal cord injury at the age of 27 from a gunshot, stroke under the age of 30, and a traumatic brain injury at age 20 from a motor vehicle accident. The challenge with assessments and interventions with these patients were lack of motivation, minimal responses or nonverbal, or attitudinal issues. The approach I took to work with these patients was to first consult with my supervisor if I felt like I needed some guidance to handle a situation. Otherwise, I would do my best to reach the patient on an emotional and appropriate friendship level. I wanted to do my best to let the patients know they could trust me and disclose their emotions to me. This helped as a breakthrough with each patient and helped to increase his or her affect and participation level. While I was going through the recreational therapy program, I had many opportunities to develop professionally through the student organizations and having the opportunity to have good relationships with my professors. Each course in the program contributed to my internship to help prepare me for what may be encountered and how to maintain a professional manner. But specifically, the information I received in recreation and event programming, treatment interventions, and comprehensive treatment programming courses appeared to be the most utilized throughout the internship. A project for Cape Fear Valley was to create a special program. However, I knew the best way to do this was to utilize the knowledge I gathered from the recreation and event programming course. For planning individual treatment and groups, I utilized resources I gathered from each of the treatment intervention classes. Throughout the duration of my internship at Cape Fear Valley Rehabilitation, I felt like I received the best instruction and experience from my supervisor, Shaquita Massenberg. Everything she does within the department is done and taught by the book, which made for an ideal learning environment for myself and any intern that may do their internship at this facility. My academic supervisor for my internship was Wendy Wisner, and she made sure to always check in with me and my agency supervisor to make sure everything was going well during my internship and with the projects I was working on throughout the semester. For future interns, a couple things I can recommend is plan, plan, plan. If you are not one to plan ahead and figure out when you will complete your work, I recommend starting. In addition to the projects and documents that needed to be completed for ECU, I also had 3 additional projects for my facility. Never be afraid to ask a question. Your agency supervisor is there to help you, so let them help you. If you don't understand something, even if it has something to do with ECU work, ask them. Chances are they have had an ECU student before and know the answer, or will help you to figure out the answer. And personally, my supervisor did not like having to repeat information. This worked out for me because I'm a quick learner and pick up on what needs to be done easily, but always do your best to stay on top of what you are being told and taught in relation to the dynamics of the department. And yes, I will be a resource for future RT interns.